Here's my audience.
Hello everyone, my name is Jessica Bevins, and today we're going to talk about a way to improve access to dental care. Have you ever been without dental insurance before? Have you ever postponed dental treatment because you couldn't afford to go? Do you have a dental clinic in your area? My guess is many of you can answer yes to at least one of those questions. I'm 26 years old, and there's been a time in my life when I didn't have dental insurance. And I was fortunate enough that I didn't have any issues and didn't have to seek treatment or worry about how I would pay for care. Did you know that according to the Virginia Healthcare Foundation, dental cavities are the most common chronic disease among children, and this is mostly preventable? Dental disease is also the cause of over 250,000 lost school hours each year. More people go without dental insurance than go without medical insurance. Today we're going to talk about the problems that we face with access to dental care, the consequences of it, and a solution. There are too many people that do not have proper access to dental care. The Joint Commission on Healthcare reports that we are in a dental shortage and that Virginia needs about 162 dentists to be out of this shortage. Many are needed in rural areas, and it's often very difficult to recruit dentists to those areas. The United States has seen a decrease in the number of dental graduates each year and also in the number of dental schools that we have. On top of that, many dentists are choosing to specialize when they graduate from school instead of going into general practice. So they may decide to become an oral surgeon, a periodontist, a pedodontist, an endodontist, and this takes away from the number of general dentists that we have. The Virginia Healthcare Foundation also reports that 3.8 million Virginians do not have dental insurance. Do you fall in this category? 66 Virginia localities do not have a dental safety net provider, which would be a dental clinic or a free clinic, a community clinic for the population to seek help that can't afford it. 81 Virginia localities do have a safety net provider, but many are only part-time. On top of that, dental school is very expensive. So a lot of the students that I've talked to will come out of dental school owing about $250,000 in student loans. Then they have to buy expensive dental equipment to practice. All these problems combined create for a very expensive trip to the dental office. So we know there's a problem with the population getting access to care, but not the entire population, mostly the poor, the uninsured, and the elderly. How does this actually affect the individual? Well, the uninsured are less likely to seek dental treatment. Private insurance is very expensive, and it still leaves the patient with a lot of out-of-pocket expenses. Low-income adults will only seek treatment when it's absolutely necessary, and I see this every day at work. There are so many patients that will deal with a toothache for months until they can afford to go to the dentist. And oftentimes they seek out the emergency room for help, for antibiotics or pain medicine. Emergency room visits from dental issues are on the rise. CBS reports that in Florida in 2010, there were 115,000 ER visits because of dental issues, and this resulted in $88 million in charges. These patients seek out emergency rooms for antibiotics because the emergency room won't turn away, where dental offices will turn them away if they don't have money to pay. So another part of the problem is I don't think people actually realize how much your oral health affects your overall health. There is a well-documented link in oral disease and diabetes, heart disease, and adverse pregnancy outcomes. Chronic oral infections can foster clogged arteries, which can lead to a heart attack. The Virginia Healthcare Foundation reports that people with periodontal disease, which is gum disease where you've lost bone and gum tissue around your teeth, are 1.5 to 2 times more likely to suffer a fatal heart attack 3 times more likely to suffer from a stroke, and are more likely to have a preterm or low birth weight baby. Oral cancer screenings also take place at dental visits. Do you routinely check the oral structures of your mouth to check for abnormalities? Would you even know what to look for? Probably not. Poor oral health also affects a person's appearance and self-esteem. And let's not forget about how painful a toothache is, how hard it can be to work or go to school or even sleep when you have a tooth that's bothering you. Untreated dental problems can kill you. There are many documented reports of the infection from an abscessed tooth spreading to your brain or your heart. I'll never forget the story I read of a 9-year-old girl who died because she had a tooth abscess and the infection spread to her brain and killed her. This is preventable. This should not happen in our society. Did you realize all the consequences that there are from not being able to seek dental treatment? How do we make access to care less of a problem? A solution I would like to propose to you today is a dental therapist. A dental therapist is a mid-level dental provider, much like a nurse practitioner or physician assistant for the medical field. They provide cleanings, fillings, simple extractions, stainless steel crowns, and some other procedures that are specifically targeted for children. According to a report by the Minnesota Department of Health, there are 32 dental therapists licensed in the state of Minnesota as of February 2014. These dental therapists often work in community health, in hospitals, and also in private practice. 84% of the population that they saw were on public health insurance, such as Medicaid. And a lot of times dentists do not care to see Medicaid patients because the reimbursement rates are low. From 2009 until 2014, when the report was done, there were no reports of safety issues with dental therapists. And this is a big thing that dentists try to say when they're fighting against dental therapists, is that it's not safe for the patients. But we have evidence that it is safe for the patients, and it's beneficial for the patients. Dental therapists work with dentists. They require a 2.5-year master's program, and they make about half what a dentist makes. They should be seen as an asset to the dental team and not as a threat. They are able to go and work in places where most dentists don't want to work. They get through school faster, and they owe less. They make less. So they are a cheaper resource for us to use to get access to care for the population that needs it the most. It would be much more beneficial and resourceful for a community clinic to hire a dental therapist to serve the low-income and Medicaid patients, because they are a cheaper labor than hiring a dentist. And although they can't perform all of the services that a dentist provides, they can help support the dentist that's on staff and help relieve the stress that they have from so many patients. So I believe that dental therapists can be recruited to community health clinics to reach the 3.8 million Virginians that we have that do not have access to dental care. People suffer much more than pain and and premature tooth loss because of lack of access to care. Dental therapists are the answer that Virginia needs to find to help solve the issue. We need dental therapists in Virginia to reach the poor, the uninsured, and the elderly. Thank you.